Hello and welcome. I'm Kyle Murphy, Vice President of Editorial at Xtelligent Healthcare Media, and we're on site at the Health Conference in Las Vegas, Nevada, here to discuss the critical role of pharmacists in ensuring healthcare access across the country. And I'm joined by the CEO of Surescripts, Frank Harvey. Frank, how are you doing today?
I'm doing great, Kyle. Thanks for having me. It's a real pleasure to be here.
Tell me a little bit more about yourself.
Well, I've been in healthcare for about 30 years. I started out as a small-town community pharmacist. I've been in a lot of areas of healthcare, life sciences, diabetic medications, but still at my heart, I'm a sort of a small-town community pharmacist, always looking out for what's best for patients.
Excellent. So let's talk about the timely exchange of patient information, particularly between doctors and pharmacists. How important is it to improve access to medications, to improve health outcomes, and to ultimately improve healthcare costs?
Well, it's a great question, and we're really at a transition point in healthcare where the physicians are feeling burnout. As you know, that one of the latest studies that came out said 1 in 5 physicians are thinking of leaving practice within the next 2 years. 30% of healthcare professionals are saying that they're going to potentially reduce their number of hours over the next few years. So it's really important that the healthcare that takes place, it's as efficient as possible. The communication between the pharmacists and the physicians, all through the network. We need to make sure that the communication is distinct, the right information is in the right hands at the right time to really do the best by the patient.
Now, interoperability is obviously a huge sticking point in healthcare. So how critical is it, interoperability to reducing care costs and improving medication affordability and adherence?
Great question again. From the very beginning, we've been really the first interoperative company, if you think about it. We're the first health information network, always focusing on making sure the right information gets to the right point. It's very critical, both from a therapeutic standpoint, but also from a cost standpoint, but the right information is getting there. For instance, with our product, Real-Time Prescription Benefit, it allows a physician to not only see the therapeutic alternatives that they have, but also the cost of those alternatives. Because the most expensive medication is one that the patient will never pick up and never take. So if you don't take cost and therapeutic impact into consideration with the patient, many times they'll never go into therapy. One of our studies have shown that on that first-time prescription pickup, there's a 50 to 70% increase in first-time prescription pickup utilizing our product.
I'm curious how the pandemic kind of brought more emphasis onto the pharmacists and ensuring access to medications, which honestly are probably one of the main things that are integral to improving your health.
Right. Well, I think the pandemic really demonstrated the important role that pharmacists can play in healthcare. Particularly the beginning of the pandemic, where even hospitals were closing down, the healthcare provider that was still open many times was the community pharmacy on the corner. That's where patients turned to for help, not only through the vaccines, but for recommendations around all the health ails that they were having. I think pharmacists really stepped up and proved their value to the healthcare system. And as we look to the future, as there's more need for other primary care providers, the pharmacist is well positioned to step up and play that role.
Excellent. Staying on the topic of interoperability, how is the growing popularity of specialty medications creating new challenges for providers and pharmacists? And then what is Surescripts doing to help?
Well, it's creating a number of challenges, not only on the picking the right therapy side, but also the right therapy at the right price side. What we've shown is using our Surescripts specialty platform is that physicians have been able to save an average of $534 per prescription that goes through the process there. Choosing the right medication, making sure it gets filled at the right place to save as much money as possible. Because from an adherence standpoint, again, making sure that the patient can afford the medication, stays on the medication, continues through therapy is extremely important. And providing as much information, not only on the therapies, but also on the price of those therapies is extremely important.
Now we talk about barriers to accessing healthcare. Obviously, drug costs is a big obstacle in the way of patients being able to benefit from the healthcare system. What can providers do to ensure that patients have access to affordable medications?
Well, they can utilize our tools, Real-Time Prescription Benefit, which shows that, again, on average, from an average prescription, not a specialty med, just an average regular prescription, patient saves an average of $38 when the physician utilizes Real-Time Prescription Benefit, which shows not only the different therapies that are available, but also the cost of each of those prescriptions.
Obviously, price transparency is very important, and there's a lot of rules and regulations about trying to inform consumers about ultimately what they're going to be responsible for. How can the adoption of prescription price transparency tools offer a solution to medication access, affordability, and adherence?
Well, again, when you think about the things that contribute to non-adherence, first of all, it's a patient not getting either started on therapy. Many times when the reason that happens is a patient will go to the pharmacy, find out the cost of the medication, and sometimes they have to choose between eating or taking the medication. So they'll just never do that first pickup or tell the pharmacist, oh, I'll come back and get it, and just never do. So it's really important that at the point of care with the physician, that they're also considering the price of those medications. Having a conversation with the patient, hey, this looks like it's going to be, $80 a month. Is this something that you can afford and can fit into your budget? Because right then, if the patient is aware of what they're going to face when they get to the pharmacy from a pricing standpoint, they're much more likely to get the medication that they're going to take and be adherent to. Again, utilizing our tools, real-time prescription benefit really helps the physician see that information and be able to provide that to the patient.
And lastly, given your experience as a community pharmacist, why are pharmacists so key to the health of individuals and communities, and what kind of support do pharmacists need to better care for their patients?
There's several reasons that they're so important to the overall healthcare system. First of all, a pharmacist is a healthcare professional that a patient sees most often. Some studies have shown that a patient will see the pharmacist up to 13 times a year. So they're with the pharmacist. The pharmacist gets to know their patients very well because they do have such frequent time with them. Again, that's one reason that they're so important. The second is pharmacists are well trained clinically. The pharmacists graduating today, they're PharmDs. They're very clinically trained. They're ready. They're prepared. They want to help the patient and help them more. When I got out, I was a BS pharmacist. There were only a few PharmDs back then. I wasn't anywhere close to as clinically trained as the folks graduating today. So again, I think they have so much capability in working in that healthcare team with the pharmacist and the physician and the nurses, getting the right information at the right time to help really contribute the most they can for patients.
Well, thanks, Frank, for your time today. I really do
Sure.
appreciate it. And thank you to our audience for watching. Take care.